Thank you to all of you who are joining us today for this very important discussion about advanced directives. I am honored to be able to engage in conversation and discussion regarding this very important topic. So what we really want for you to take away from today's program, we want you to be able to understand advanced care planning and why it's important. There are so many reasons, and we'll touch on several of them, but we also want you to have more confidence in having these challenging conversations with family and friends and your healthcare providers. We want you to be more familiar with specific planning documents, such as the healthcare power of attorney and the living will documents, and to understand how to complete these documents. What do they mean? What questions are they really asking you to answer? And providing important reminders about keeping your information up to date. Things change all the time, and so should your documents if your wishes change along the way. So we'll just dive right on in. So advanced care planning is very important for so many reasons. It allows you time to think and meticulously plan out the direction that you want your care to be provided in the setting where you're not able to provide your own answers. Your needs, your values, your beliefs, those are all important components of how you're creating your advanced care documents. Your planning gives the individual control about choices. You know, if we don't share what our goals and our wishes are with our family before we're not able to, sometimes they're guessing or they're saying, well, I think this is what they want, but they're not really sure. And so giving the gift of confidence is so important. It ensures that you are an important stakeholder in the decisions for how you want to live and how you want to be treated. In the medical world, there are lots of things that we come across, lots of questions, lots of treatments, lots of comfort care measures. There's all kinds of things. And if you don't have these conversations, then you don't have a voice in what your care looks like down the road. It allows for close family and friends to have an understanding of your wishes. As I mentioned earlier, it gives your loved ones confidence in the decisions that they're making for you in the event that you're not able to make them yourself. It also helps your physicians and your medical care providers understand ahead of time what you want your care to look like. So many times there are encounters that are brief. You may say, this is what I want in the moment, but we don't venture down the road and share exactly what we would want in the event that our situation changes. So having those conversations prior to those situations is the best way to do it. So starting these conversations can present with several challenges, and we'll review a multitude of them today. The first being that there are personal taboos about death. Who wants to talk about dying? That's so depressing. Or, you know, I don't want to think about something that is way down the road, or so we think. We're reluctant to acknowledge the impending mortality. Nobody wants to think my life is limited. I only have so long to live. People live in the moment and they want to enjoy what they have. Sometimes it's hard to envision what needs you may have or what things you may want to think about if your situation changes in the future. The inability to know one's own cause of death. You know, some of us are fairly healthy. We live a fairly active life. We take care of ourselves. We have no idea what the future holds. We don't know if we're going to encounter a life-changing diagnosis. We don't know if we're going to encounter a life-changing event such as a car accident or something of that nature. So when we don't know what to plan for, it's hard to plan. Perceived irrelevance. I'm too healthy to discuss death. You know, some people have that mindset, well, I'll handle it when something comes up and there's question. It's easy to fall into that trap, and it's but it's even more important to have those conversations because we don't know what impact that first situation is going to have on our lives. Traditional medical goals are generally geared towards treatments and cures. You know, there's resources and trials and research and all of this money and time and energy going into all of these wonderful things that are working towards treatments and cures and trying to make things better. That's just the way that things are kind of geared for. And so it's hard to say, you know, of course that's what I want, but if it doesn't work, this is kind of my plan. Assuming family and physicians already know what your wishes are. Sometimes you lead a life that you feel maybe out in the open and people can kind of read you easily, but sometimes we think people perceive us in a different way, and it's not as easy for our family and our friends and our providers to really know exactly what we want. So having those conversations are important. We have hope for a future cure or for any disease that we may have. As I said before, there's all kinds of research and trials and things for the next big break in certain disease processes. And so we kind of put off planning, thinking, okay, well, there's going to be an answer for my situation, so I'll make these decisions later. We wait for our physicians or our medical providers to bring up the topic to us. They know it's important. They see it every day. They see the challenges they face if these documents are not in place, and they see when they are in place and how smooth things can go. But they have a lot on their plate, and they don't know if you're ready to have that conversation. So it's up to you to bring this up to your physician so that you start the conversation and say, hey, what do you think about this? There's a disconnect between not knowing what your cause of death is going to be and what might be needed for treatment and care. You can say, you know, I may not want this set of treatments or modalities if I'm in this type of situation, but if it's a little minor situation, maybe I would want to pursue an antibiotic or maybe a blood transfusion or something if it were more of a minor scale. So it's hard sometimes, like I said, none of us have a crystal ball. We don't know what life is going to bring us. And so it's hard for us to say, well, if I'm in this situation, this is what I want. If I'm in this situation, this would be what I want. It's hard to decipher that sometimes. There's a disconnect in the medical community at times between physicians and care providers. Some of the care providers in the community may be very for treatments and cures and have a really hard time facing that there's not an answer. And then there are some physicians that are more apt to listening and saying, what do you want your plan of care to look like? So just knowing that sometimes there's some disconnect in the community and making sure that you're having these conversations prior to the time of need to be prepared for that. Poorly documented decisions about goals of care. So either you don't have an advance directive at all, you completed one 20 years ago and it does not reflect your current wishes because you did not update it, or it's not filled out in its entirety and there's a lot of guessing that the family and the healthcare providers are having to do. So make sure that you're very clear and concise in what your wishes are and your goals are, so that your family feels comfortable and confident in the decisions that they're making for you. So the last challenges I'd like to cover is sometimes there's a lack of continued discussion. So as I said, things change. You may complete your advance directive when you're in your 30s, which is great. I completely encourage that. But things change in life along the way, and sometimes our wishes change. Sometimes we may get a significant diagnosis that changes the way that we view things, or, you know, the way I feel in my 30s may not be the way I feel in my 80s. So if I go 50 years and don't update that, we might come into a problem later down the road. So making sure that you're continuing these conversations and you're updating your documents. Misconceptions about the purpose of advanced directives. Some people have all kinds of ideas on what these forms are for. Ultimately, it is for you to provide direction and share what your goals and your values and your wishes are regarding the care that you want to receive. One thing I do want to point out is a lot of times people say, I don't want to do this yet because I don't want somebody making a decision for me yet. Well, the decision maker is not sought out to make any decisions until you yourself are in a position where you cannot do so for yourself. You're unconscious, you're in a coma, you are in advanced dementia, and you just are very confused, those types of things. So that document is not utilized until you are not able to engage and make decisions for yourself. Sometimes there's complications with religious views. There's different things about medicine, do not resuscitate, life support, nutrition, hydration. Some faith traditions have different limitations or guidance as far as some of these things go. And so that can cause some challenges when you're making decisions as well. And lastly, judgment from others about desires and decisions. This is so important to make the decisions that you feel are right for you. Don't make a decision because you think that's what your son wants, or that's what your spouse wants, or that's what your best friend wants because that's who you're naming as your healthcare agent. It's so important for you to think through this and really come down with the decisions and the care plan that you want to see put forth for you, not for anybody else. So over the last few years, we have created a special program here at Hospice of the Piedmont to really start the conversation and help you understand how to make decisions for yourself that follow these SMART guidelines. We want your decisions to be specific, meaningful, achievable, realistic, and timely. So those are the 5 things we really want you to focus on when thinking about what your care plans should look like. So being specific when communicating your wishes, think about and follow through with conversations that will likely have 2 parts. You're going to be talking to your family, to the people that are closest to you, who are actually going to be your decision makers. But you're also going to be talking to your physicians, your primary care physician, your oncologist, your whatever physician you have that you work closely with. Having conversations with those 2 sets of people are going to set you up for success because they're going to know exactly what you want, how you want it, where you want it, when you want it, and why. You want to begin by thinking about your choices in care and treatment for any future healthcare needs, and write down your thoughts. The healthcare power of attorney and the living will documents that we typically use here with Hospice of the Piedmont do give some space on there to identify specific instructions, limitations, things that you want your healthcare agent to know for sure. Of course, any document is limited in space, and so if you want, you can certainly write down specific instructions to go along with your advanced directive and maybe just keep it together. And that way your healthcare agent can then access those points and refresh their brains, because we all have things that are going on in an emotional and last minute decision situation. They may need something to reference just to feel more comfortable about the decision they're making. And we want to ask questions to professionals who have an understanding of diseases and common struggles. They have been a part of so many people's journey in very similar situations, more than likely. And so they may have some helpful tips or guidance in how the care may unfold and what to expect. And that may help you make your decisions on what care you would like to see down the road. We want you to have meaningful conversations. We want you to be purposeful in who you choose to take part in these conversations. If you have somebody that's in your life that's very controversial, they're always questioning things, they make you second guess kind of your decisions. That may not be the best person to engage in the initial conversations. We want you to be comfortable and confident in the conversations you're having, and make sure that the people you're engaging in those conversations are supportive and willing to help you navigate through that process. You need to review your documents ahead of time and bring them to conversations to assist in your discussions. Sometimes you can bring them and say, hey, these are the things that this document lays out and the questions that they're asking. What do you think about this? And just have a dialogue about it. Have a discussion in a setting that's appropriate. Maybe doing something in the middle of a crowded restaurant might not be the best option. A place there's lots of distractions, the TV's on, there's children running around. You may not want to do it while somebody's in the middle of a work day because they're getting calls. Just make sure that the setting is appropriate. Ensure that those that are needing to be present are there. Invite everybody that you feel are going to be supportive and help you guide your care, your decisions in a positive way. Have some conversation starters in mind. Sometimes these conversations don't come easily. They don't flow very easily. It's a very difficult thing to talk about sometimes. So having conversation starters, things in your brain on how to initiate these conversations is helpful. And later in the presentation, we will share a few of those for you. Be sure to share with your provider and family your needs, values, and desires. Ultimately, this is about what you want. So if they know the why, they're more than likely going to follow through with what you want because they know exactly why you want it that way. And ask questions. Not only is it important for you to ask questions of your providers and your loved ones, but allow them to ask you questions. Dialogue is healthy for them to know and understand exactly what you want and why. Helps them navigate the process when it's their turn to actually make those decisions for you. Set goals that are achievable. Of course, we want to do this in anything we do in life. So when we're talking about end of life or care planning, why would we do anything different? We want to think about time frames for having conversations. You have a quick 10-minute window. That's not the time to sit down and have this conversation. We want to make sure that you have ample time to answer questions, discuss certain situations, and have time to really navigate through this discussion. Allow enough time for having these conversations without distractions. So if you know that you have an appointment within the hour and you're going to be looking at your watch every 10 minutes to make sure that you're not late, or you're anticipating several phone calls to come in, maybe pushing that conversation to another time frame so that you're not distracted. Think about any health concerns that you may have going on currently and how that may affect your life right now. And then focus on the concerns for advanced decisions. Is this a situation that is going to get worse over time? What is that going to look like? How am I going to want the care to be provided if and when it does get worse? How does that impact the decisions that I'm making? Ask professionals what decisions you need to consider for advanced care planning. Your doctors and physicians and providers, they are wealth of information for you to utilize and ask questions because, as I said before, they've seen it, they've watched journeys, they've participated in treatments, they've done all kinds of things with their patients, and so they can be very helpful when guiding questions and your care planning. Remember to review your documents at least on an annual basis, and of course at time of healthcare changes or health changes. You may make a couple small little tweaks here and there, but then you get hit with a diagnosis of diabetes and you're having to alter the way that you live your life, the way that you eat, the way that you administer medication, all kinds of things. So things could snowball. And so when you get any type of changes within your health issues, it's important to look at these documents and just make sure, did this impact the way that I would want my health care to be provided if I can't speak for myself? So we want you also to be realistic about expectations for yourself and for others. Be open to discussions with your physician about trade-offs and limits. Say, you know what, I might be okay and open to doing something like this, but this over here is an absolute no. Let them know what you may be willing to try and what you might not be willing to try. Talk to your physicians and say, okay, if I can't do this, what are my other options? Utilize your resources to have discussions. Express your fears. This can guide conversation. I think this one is hard for some people because it's hard to say, I'm scared. It's hard to acknowledge that we are going through something in life right now that we are so unsure about, and it's very unsettling. But sharing those fears and those thoughts can really open up dialogue and allow your providers and your family to offer support and guidance where it's needed the most. Being honest, both with yourself and with your providers and your family. We want to make sure that what you really want is what you're conveying. And we also want you to acknowledge that this is not easy. Making decisions prior to being sick is not easy because you don't know what may lie ahead, but also making decisions when you are faced with a health challenge. You know, is this the end all be all? Am I allowed to change my mind? There's a lot of questions that go in that. And so just be honest with yourself and know that, you know, you're going to need a lot of grace through this entire process, start to finish, and just allow people to help and walk with you through this journey. If at all possible, don't ask loved ones to make promises. In the work that I do, I hear a lot of times family members share with me that they said, I promised my mama or I promised my daddy that I would not put him in a nursing home. As much as none of us want to look in that avenue as an option, there may come a time where you may have to look at that option. You may have health issues yourself and you're not able to provide the care anymore safely. You know, your loved one may actually have significant care needs that just one person can't handle. And so that's just one example of things that people say, and then they feel guilty saying, I'm sorry, I broke my promise. So try not to encourage or make your family members or your providers make promises to you. Expect that there may be some discomfort in conversations. Some people may be very open in talking about death and dying and plans. And some people are like, I don't want to talk about it until it's knocking on my door. So just know that there may be some resistance, there may be some discomfort and hesitation, but these conversations are so important to have prior to the time of need so that there's no guesswork involved. We want you to be timely in your planning. This is not a one and done process. As I said before, some people are concerned that they can't change this process or change these documents. The first step may be the first of many conversations. There is no way that you can cover all the situations and the layers of this conversation in one sitting. Choose a time when you're not rushed. Every attempt at a conversation is valuable. It shows that you're passionate and you're dedicated to make sure that your care is provided in the manner that you want it to when that time comes. So as I mentioned before, we are going to share a couple little tips for conversation starters, ways that you can engage in dialogue with your family and start these conversations. So the first being, this may not be the easiest of conversations, but one that I feel is necessary. So you're giving them a heads up. This is not an easy topic, but I think it's important and I'd like to have this conversation with you. So you're letting them know up front, might be a little uneasy, but it's important, so bear with me. I need your help with some things I've been thinking about regarding some healthcare decisions. That allows the person you're engaging to be invested and to feel like that their input matters, that you want to have a discussion, not that you're sitting down saying, okay, this is what I want end of story. When they're engaged and when they're asked questions and they're saying, well, hey, what do you think about this? Sometimes they engage a lot better in conversation that way. I was thinking about what happened to so-and-so, and it made me realize sometimes we have people in our lives that go through certain events or situations that unfortunately can be, situations that nobody wants to come across. But sometimes you can use that as a conversation starter, saying, our neighbor just had a fall and broke her hip, and now she's seeking care and needing to adjust how she does her daily life. I don't know what I would really want to do in that situation, so can we talk about that a little bit? It's easy to kind of say, hey, this happened over here, so maybe this is how we can start the conversation. I've been thinking about and answering some questions about how I want the end of my life to be. I want to go over them with you, and I'm wondering what your answers might be. So telling them that you've been thinking about this and you've been planning and you've been wondering and you want to really engage in some conversation with somebody and kind of reel them in that way. I think I might need some help planning my future healthcare decisions. I just am not sure where to begin. Being honest, saying, I don't know where to start. This is so overwhelming. Going to your loved ones to really come down with a broken down plan and take one little chunk at a time. Sometimes that can be a little bit easier to manage. I've listened to some information, or I've listed some information for you that I want you to know, such as my physician's names, my medications, my pharmacy information, insurance information. Sometimes we focus so much on the care that we want or don't want, we forget what's happening in my life right now. So having this type of information handy for your healthcare agent is so important, because if you're in a situation and you can't answer these questions, they need to know where to find this information. So having that prepared in some way and easily accessible by your healthcare agent is probably a good idea. What matters to me at the end of my life is, this is the why. This is the important piece that if you share what matters to you, it kind of wraps everything up in a little bow. It says, this is what I want, and this is why I want it, because this is what matters to me. It brings kind of that emotional component into things and really sheds some light on why you've made decisions the way that you have. And a lot of times it brings comfort for these healthcare agents to know, this is why I'm making these decisions for my loved one. So there are two documents. The document that we use here with Hospice of the Piedmont and Hospice of Randolph is actually a three-part document. The first part is the healthcare power of attorney. And the healthcare power of attorney is a legal document in which you identify a specific person to make decisions for you when you are in a situation that you are not able to do so for yourself. As I mentioned before, that document is only utilized and officially in place when you cannot make those decisions for you. It identifies who you want to make a decision. It gives a secondary person in the event that the first person is not available or something happens to that first person as well. It gives space for you to identify specific instructions, limitations, guidelines for them to follow. It talks also a little bit about organ donation. Is that something you would like to potentially pursue if that's an option? So it lists all of those things on there. The second part, Part B of the document, is the living will. And the living will is a document that you are able to identify in these certain situations, would I not or would I want some type of life prolonging measures taken? The situations included in these slides are, you have a condition that is incurable that will result in your death within a short period of time. You are unconscious and your doctors are confident that you cannot regain consciousness. Or you have advanced dementia or other substantial and irreversible loss of mental function. So in these three situations, you can say, I do or I do not want life-prolonging measures taken. It also allows you the space to say, even though I don't want life-prolonging measures in these situations, I may or may not be open to having a tube feeding. It talks about the importance of, regardless of what my care guidance is, it's important for me to be comfortable. I want comfort in whatever decision that we make here. And lastly, it identifies the option for you to say, I want my healthcare agent to follow my living will 100%. I don't want any deviation from what I've listed here. Or you can identify your healthcare agent to have more power, per se, to maybe make a couple adjustments if there's more of a minor decision to be made. You may have indicated that you don't want any antibiotics for an infection, but if it's something as simple as a urinary tract infection, you may want an antibiotic because it's not necessarily something that's super invasive. So they have the flexibility to maybe alter your wishes just a little bit. But that is the biggest reason why you want to make sure that who you choose as your healthcare agent to be one that you trust and you know is going to make the decisions that you want them to make, not decisions that they want to make for you. I cannot stress that enough. Some people say, oh, I have to name my spouse, or I have to name my firstborn, or, there's a misconception that it has to be a certain person in the family. The only requirement is that they're willing to be the healthcare agent and that you trust them to make the decisions on your behalf when you're not able to make those decisions on your own. So when you're preparing to complete your documents, we want you to remember that you need to review them annually and at time of health changes. Nothing is set in stone. You can change it monthly, you can change it annually, you can change it every other day if that's what it comes down to. We just want to make sure that the most recent document is what really reflects what you want your care decisions to be made when you can't do so for yourself. Make sure that you keep an original. The original that has your signature on it, the notary stamp on it, make sure that you keep that in your possession. Make multiple copies, provide it to your healthcare agent, to your family members, to your providers, to the hospitals that you attend. Make sure that everybody has a copy of this document because we never know at what point we're going to have to access it and actually utilize it. Don't keep your documents in a locked location, such as a safety deposit box where others may not have access to them. It is completely fine to keep them in a safe location in your home, whether it be a lockbox or a safe of some kind. We certainly want to protect the documents, but make sure that your family or your healthcare agent have access to it. They have a key, they have the code, so that they can get to it if they need to. Once you have completed the conversation about healthcare decisions, you may also think about completing directives for financial and legal situations as well. There may come a time where you can't make healthcare decisions, and that would also kind of trickle over to financial and legal decisions as well. Those are two completely separate documents. There is a legal power of attorney, and that's for the finances and the your banking and your bills and all of that. And then your healthcare is strictly just for healthcare decisions. So it may be helpful to think about doing a legal power of attorney as well. So just some things that we want you to remember. Planning is a gift, not only for yourself, but to your family members. You are giving people guidance and a footprint or a blueprint of how you want your care to be provided. So not only are you telling them, this is what I want, but you're allowing them to feel comforted and confident in the decisions that they're making. Remember, you are getting ready to help design how you want to live and die in a way that you have personally chosen for yourself. This gives you a voice. You put it in writing, you have these conversations so that when the time comes and somebody else is making your decision, you've laid it all out for them. There are no wrong choices in your healthcare decisions. Just because I may make a decision for myself doesn't mean that that's the right thing for you. That's why it's important to talk with your providers and your family, and whoever that support system is for you. It's important for you to have these conversations so that you feel like you're making the right decision for you. It is never too early to start these conversations until it's too late. We never know what tomorrow brings. As much as we love to live in the moment and, think that nothing bad's going to happen, it could at any time. And so it's important to have these conversations and have these documents in place to hopefully, maybe in a long time, utilize them. But in the event that you need it now, it's here. So we are happy to assist you by providing the advance directive document and/or assist with completing this document when we're ready, when you are ready.